Hello and welcome. Do first-time mums need a hand? How many women have either chemical or surgical interventions during their labour and birth? How do your anxiety levels during pregnancy and labour affect your overall birth experience? Well, I'm Trisha Murray and welcome to the Birth and Baby Academy. How are you feeling around your upcoming birth? Are you feeling confident and calm, or are you like the vast majority of women who feel nervous and anxious and even panicked about their upcoming birth? Well, it doesn't need to be like that. I've worked with hundreds of women pre-birth, during birth and post-birth in groups and one-to-one, so they're able to experience a much better birth experience. At the end of the session, I'd like you to go to birthandbabyacademy.com and download my free download 101 questions you may have around giving birth. This is a free tool for you to use to get you really thinking about all the different questions that you need to consider so you can prepare positively for your birth experience. So let's get into the topic in a bit more detail. So today we're talking about, do first-time mums need a hand? And this is something that I was shocked recently to hear a consultant say to one of the ladies in the local area. She was told that most first-time mums need a hand. And this is something that I'm hearing more and more of when I work in the clinic with women who are affected by birth trauma. More and more stories around induction. So I decided to contact the local NHS trust under the Freedom of Information to ask them how many women are either chemically or surgically intervened with during their labour and birth. So this would be, were they induced, which is when labour is started artificially? Were they augmented, which is when labour is quickened? Did they experience an episiotomy, which is when they have a surgical incision into their vagina, or did they have a caesarean birth? And the number that came back was actually astounding. It was 63%, and that was a rise of 10% over the previous 5 years. So 63% of women can't give birth without either chemicals or some sort of surgery. It's absolutely huge. Now, bearing in mind that our bodies are absolutely perfectly able to give birth, and bearing in mind that we know that the safest place to give birth is either in a midwife-led unit or else at home, it is just incredible that these figures are so high. Does this make birth safer? Well, there's more information coming out that these interventions don't make birth safer. There's been no reduction in any adverse outcomes. In fact, it's been the opposite. There's been more and more mistakes made due to human error. So here's a local mum, Vanessa, who went in to see the midwife around her due date, and she was routinely booked in for an induction, which is where they artificially start labour 10 days after her due date. Now, Vanessa was very clear that her due date was actually incorrect. She believed that the dates were around a week out. However, she didn't have the confidence to say, actually, these dates are incorrect and I would like to work to my dates. But at 10 days over her due date, she went in and started the discussions around waiting for a bit longer, and she was told to go and see the consultant in the hospital. She asked whether she could have daily monitoring instead, and could that be her option. So she went in for daily monitoring, and after the second day of this monitoring, she was really pushed into going for induction. She was told that she was putting her baby's life at risk. Now, bearing in mind that she considered that her due date was around a week out of her actual due date, and bearing in mind that most first-time mums don't give birth until 8 to 10 days after their due date, then she was still very much within the sort of normal range of giving birth. After the second day, so really in terms of her own thoughts around her due date. She was only really about a week beyond her due date, so still not within those 8 to 10 days of the average first-time mums. She went in to start the induction process, and her process was very like a lot of other women in the UK. In fact, I would say thousands of other women in the UK every single day. She had a 4-day induction process, which resulted in a very difficult labour, a distressed baby, and the overall result was a caesarean birth at the end. Now, I'm not against caesarean births and I'm not against interventions because these do save lives. But issues such as what happened with Vanessa are typical and demonstrate why routine intervention isn't always the right decision to do, because whilst at the end of the day there's a healthy baby is not all that matters. Having a healthy mum, both physically and emotionally, is just as vital. So let's consider what happened to her and what could have been done differently. So often women are intervened with around 10 days after their due date. But if she was just given a bit more time, bearing in mind that she's not a robot and that many women give birth beyond 42 weeks, that she might have been able to achieve a spontaneous vaginal delivery and ended up in a much better place post-birth, physically and mentally. The other thing that often happens with these women is that once they start to have that pressure put upon them, they really struggle to start giving birth, because when you have to think you can't give birth, and when you start feeling anxious and fearful, anxious that something's wrong with the baby, that something's wrong with you, when that level of anxiety and fear starts to come in, we start to worry, and it's not the optimum conditions for you to then go into spontaneous labour. Your body almost tenses up completely and you can't relax into the process because at the back of your mind you're thinking, oh, what's wrong? Why is this not happening? So there's lots of different reasons why that whole process doesn't necessarily work. Now, I'm not giving you medical advice here, and I'm not saying to you not to go forward with induction at 10 days beyond your due date, because for many women that might be a positive decision that they've made. But when you have that induction pressure and you don't necessarily feel that that's the right decision, and then you end up with feeling very traumatised by the whole labour and birth process, that is an issue, and feeling coerced into those decisions. So how are you going to build confidence and get informed and allow yourself to relax so you can experience a much better birth? Having a positive birth experience doesn't come from inaction, it comes from everyday commitment and dedication. So what are you going to commit to today? It's time for you to relax deeply and learn wisely and experience a much better birth.